This episode of the Practice of Therapy podcast is brought to you by TherapyNotes, TherapyNotes.com. TherapyNotes has everything you need to manage patient records, schedule appointments, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. It's what I use in my practice. And now they have a patient portal that provides telehealth. It's a HIPAA-secure telehealth portal all in one place that's easy for you and easy for your clients to access. So be sure and check them out today, therapynotes.com. And if you'll use the coupon code Gordon, just Gordon, you can get 2 months of their services for free. This is the Practice of Therapy podcast with Gordon Brewer, helping you to navigate your private practice journey. This is session number 135 of the Practice of Therapy podcast. Hello, folks. I'm Gordon Brewer. Glad you're listening to the podcast. I hope that you're doing okay and that you're having a good week so far, or weekend, whenever you might be listening to this. And thanks for joining. If this is your first time listening in, glad you found us. Glad you're here. If you're coming back for more, I'm glad you're back. And I hope that you and your family and everyone you're involved with is doing well during these strange times. As I'm recording this, we're here about to close out the month of June already. It's hard to believe that time's going by that quickly. But yeah, so I hope you're doing okay. I'm looking forward to you getting to hear from my guest today, Danielle Blessing Taylor. And again, Danielle's one of those great folks that I met online. And she reached out to me about talking about telehealth and how her practice is set up. And she's got a really cool model. So I'm looking forward to you hearing from her about that and how she's got her practice set up. When the whole COVID-19 pandemic hit, she was already doing telehealth long before that. And so I consider her a bit of an expert in just how she's got things set up. And, she's really kind of introduced me to a new kind of business model around doing therapy that's a little unconventional, but also I think would work really well for a lot of people that are maybe getting started in their practices, and even those of us that are have been in it a while, of looking for ways to maybe save a few costs and really kind of downsized to some degree. So anyway, looking forward to you hearing from Danielle here in a minute. I wanted to make sure that you're aware of a big sale that is going on with my friends over at Brighter Vision. So from now until July 7th is the deadline for this, but they're having one of their biggest sales of the year. It's their July 4th sale. And for right now, if you sign up for their services, you can get the entire first year of service for just $49 a month, plus pay no setup fees. So that's a savings of over $200. So it's a great time to get hooked up with Brighter Vision and work with them. So if your website is needing some updates, if you're just not pleased with your website, or if you don't have a website, I would highly recommend you talk to my friends over at Brighter Vision. Perry and his team will work with you to help you create a website that is personal to you and personal to your brand or to your practice. And they do just such a great job with helping people out with that. And they help you out with things like SEO and making sure that your website is found and all those kinds of things, which are so important when creating a website. So right now is the time to check them out. And so if you'll go over to practiceoftherapy.com/brightervision, you can access their services and get that big discount while it's going on. And just full disclosure, if you use that link, practiceoftherapy.com/brightervision, I do get an affiliate commission with them at no extra cost to you. So I just like to be transparent about stuff like that. So anyway, check them out. It's a great time to hook up with my friends over at Brighter Vision. Also, during the month of June, as I've mentioned in previous episodes, I've got my G Suite for Therapists course available at 20% off. So if you'll go over to G Suite, if you'll just go over to, I'm sorry, my mind is in a fog this morning. If you'll go over to practiceoftherapy.com/G Suite course and then use the coupon code June 2020 when you check out, you can get that course for 20% off. And I've had hundreds of people to take that course. And also I have the Facebook group, G Suite for Therapists, to check out as well, where people are asking questions and talking to each other. That group has just exploded over the last several months. There's over 2,000 members in that particular Facebook group for therapists and just those people that are using G Suite in their practices. And so just want to make you aware of that. So also just as another little shout out here to my friends at TherapyNotes. They have been such great sponsors of the podcast over this year, and just want you to be sure and check them out as well. I know in this particular episode we mentioned another brand of electronic health record systems, and I think you've got to find what fits for you and works best for you. I like TherapyNotes because I use them in my practice. And one of the things that's cool now is that TherapyNotes does have a telehealth portal available that's a HIPAA secure portal where you can just do it all in TherapyNotes. So I wanted to make mention of that. So anyway, without further ado, here's my guest today, Danielle Blessing Taylor, and I'm looking forward to you hearing from her and how she's using telehealth as her primary mode of providing services in our field. Hello, everyone, and welcome again to the Practice of Therapy podcast. And I'm so happy to have with me today Danielle Blessing Taylor, who's another fellow marriage and family therapist. And so welcome, Danielle.
Yeah, thanks for having me.
Well, I'm glad you're with me, and I'm glad you connected with me because I love, as we were chatting before we started recording, I kind of love the model that you're using in terms of how you're providing services for people, primarily through telehealth, but I'm anxious for people to hear kind of the other little twist to how you see people, which I think is exciting. So as I start with everyone, why don't you tell folks a little bit about your private practice journey and how you've landed where you've landed as a clinician?
Yeah. It's been an interesting journey, and I feel like I was pushed into it at the beginning. I felt like I wasn't ready, but I looking back, I needed that. So I worked for a group practice after working in residential facilities and schools and community mental health. I worked in an agency. Then I landed in a group private practice, which was really great. And they ended up kind of downsizing and encouraging me to start really my own practice from there. And that was in 2015. And I felt like, I wasn't ready because I had graduated school in 2012. But they really encouraged me. That I had really great supervisors who I'm still in contact with. So I had a good amount of clients when I started, which was good. And I was insurance-based, which I love because it keeps the flow going. And then my husband got a job in California, and we were living in DC at the time, and that's where my clients were. And so me and my husband were thinking, well, how can we take this practice? Like, can I use Skype or FaceTime, or how can I keep this going? Because I had such a good base. And then I looked into how to do it ethically and HIPAA compliant and all of that, and the state regulations. And so we moved to California, and I kept all of my clients, but then couldn't see anybody physically in California. One, because I knew I was not going to stay there forever, and I didn't want to start with clients, but also because the regulations are, if you see a client in California, you have to be licensed in California. And there's a lot of hoops to jump through in California.
Right.
So I just kept everyone and kept coming back because he had to come back for his company anyway. He was based out of DC. So I would see clients in person every couple of months. And then I just kind of kept that going. We were there for a couple of years and then came back to Pennsylvania last year. And so I still do that. I take the train, Amtrak usually, up to DC or down to DC and just see people in person every couple of months to keep it broken up and to keep that connection going.
Right. And I think you said you sublease an office when you do that.
Yeah. It's in, because I've made those connections in DC, I now have those, which are really great. And so the clients go to the same location every time, and they've been doing that for years. And they can meet me in person. I encourage people to at least meet me once, but a lot of clients just prefer to keep going telehealth because it's easier with kids and commuting.
Right.
Now they have to, but.
Yeah. So you're one of the people that when we made the mad scramble when COVID-19 hit to switch over to telehealth, nothing really changed for you then.
Yeah. No. And I've just been helping people, other therapists, learn how to do it because I've been doing it for so long. It's like second nature. It's really just teaching them what I know.
Yeah. So there's a good question. What are, I guess maybe what are your tips around doing telehealth that, and I'm sure people are curious about platforms that you're using and tools that you use. And so if you don't mind, just kind of walk us through what you like to teach people.
Yeah. Well, I use Simple Practice. I love Simple Practice. It's very simple, but it has everything, scheduling and billing and all of that. At first I started off having an Excel spreadsheet, and my husband was kind of my numbers guy, and he would help me put the equations in and track how much I was making. And I was still taking insurance. So tracking each insurance company and all that. And it just became a headache. And so getting electronic record system was good. And then I just help people, keeping it separate. So setting up your LLC or sole proprietorship or S Corp, and then keeping it separate from your personal stuff, because then when taxes come, it's easier to just kind of look at your credit card and bank statement and just kind of write off from there. And just like tips and tricks, like how to position the camera at the top of the screen, put their head at the top of the screen, encourage them to, so that it looks like you're making more eye contact, and troubleshooting tips, like if internet goes out, encouraging them to restart their computer, updating the browsers is really good. Updating the computer, which is something I didn't realize a couple years into my practice. I was wondering why I would randomly have, no sound or something. And it was like clearing the cache in the browser and then updating the actual computer system. I realized I had all these updates I hadn't updated in years. And just little things that people wouldn't think about.
Right. Yeah. So with on the client side, how do you kind of prepare your clients for doing telehealth if they've never really done it before?
Yeah. Well, a lot of it's in the paperwork. So I give them Simple Practice kind of gives them a little tips and tricks form, which I forward to them of, how to get initially set up, but then also how to troubleshoot if you have issues. And then just encouraging them to be comfortable at home in a private space, as long as nobody can hear them. And just not in a moving car, basically.
Yeah. Right.
And just knowing where they are, getting the location every time. And I'm sure, you can recognize their background. And if it's different, just asking where they are and making sure you're licensed in that state. And sometimes they don't realize that. So what I do is I have a policy where even though it's in the informed consent that you have to let me know, I mean, it's really human nature to not. And so they'll show up in, Mexico, or they'll show up in, Arizona. And I'm like, oh, well, we have to end the session. We can't start the session. And I just look at the regulations, and I have a policy where I let them kind of do that once. And then from there, without a charge or anything.
Right. Yeah. Those are things that we really have to, particularly if we're seeing folks within the United States, we have to be, I guess, mindful of those various regulations. I know that there are some therapists that work mainly with expats that are living abroad, and that's that's a whole different area that I think a lot of times clinicians could tap in on in terms of having a practice that deals with those types of clients. And so I think there's a lot of opportunity with this telehealth in general. And as people have heard me say before, I think it's really going to become much more of the norm. I know even now, in my practice, when we switched over to telehealth, I was really surprised at how smooth the transition was, particularly for the clients. There were some clients that didn't want to do it, which I understood. But I think even now we're seeing, I'd say even a third of my clients I'm still seeing online, even though we've transitioned back into the office. But that might change as we're recording this here towards the end of June, with the cases starting to spike again. With the COVID-19. Was setting up the business model that you have with recognizing telehealth, was that something that was intimidating for you at first, or was it something that just seemed to come naturally?
Yeah, I think it was uncomfortable at first. I don't know if you felt the same doing telehealth. It's like, it's you're used to seeing somebody in person and their body language and everything, so it's a little weird not being able to see them from the waist down. But I eventually got comfortable with it, and I started adding things into my questionnaire that I wouldn't have thought about before. Like, do you have any physical limitations, or because sometimes you can't even tell if somebody's in a wheelchair because it looks like they're in a chair. Or if I have, clients who have muscle issues, and you don't see them walking in, so you don't see that they have a problem with that, and that is related to their self-esteem and their issues. So I ask a lot of those for them to let me know if they have any physical ailments. But yeah, at the beginning, that was uncomfortable, not knowing all that, and then just getting used to talking to them online. But now it's such second nature. I find it so much easier because they're more comfortable, in their bed, in their pajamas, wherever they are, just so much more open and less sterile. And
Right. Yeah. How's it working for you? I know you do couples work as well. How does that, I know that there have been, I've heard from other therapists that just say it's difficult to do couples work doing telehealth. What are your thoughts on that?
Yeah. Well, having to know their names is very important too, because you can't just look at somebody and talk to them. Like, you have to keep addressing them by name when you want each of them to talk or when you want their opinion. So that's something I always keep in mind. But then it can be a challenge if they start escalating, or it's different when a therapist can kind of stand up or move towards the front of their chair or something, or make some sort of gesture. But for not being able to do that, it puts you in an interesting position, because you're not like on the same level as them, and the computer sometimes is lower, so it changes the dynamic, and so they can get louder, and you can only get so loud, or not that you want to match their, but I've used that as a positive too, because modeling, being able to calm down and encouraging them to go into the other room, which is different, I think, than in person, because you can ask them to step into the waiting room, but there's really no other place for them to go to calm down when they're in the office. So a lot of times one of them will go take a walk, and I'll talk to them after they've calmed down, in each of them. And so separating the couple
Mm-hmm.
Um, but I mean, it can be a challenge. I think couples are a challenge in general because it's double the work, double the stuff, double the
Mm-hmm.
issues. But I haven't found telehealth specifically to be different
Yeah.
with them. Yeah.
Right. Right. Yeah. And so I guess another issue that comes up for people and just thinking about some of the logistics around telehealth is
Mm-hmm.
how are you handling, or how do you handle maybe higher risk clients that are
Mm-hmm.
maybe you're concerned about somebody having suicidal ideations or that sort of
Mm-hmm.
thing, or just really uh, worrisome depression, that kind of thing. What have you
Yeah.
found that's helpful with dealing with those types of clients?
Yeah. Well, I always recommend that they have somebody in person that they can see also, like a psychiatrist. Um, because somebody I feel like needs to monitor them, especially if they have self-harm behaviors and if they have severe depression, they have trouble getting out of the house. Having therapy in your house, while it can be comfortable and you're meeting them where they're at, like that person-centered approach, but they also need to work on getting out. So seeing somebody in person. But I've had that situation where I've had somebody, a couple of people who have felt suicidal and having to, you can't call 911 when you're, in a different room than them because
Mm-hmm.
the police will show up at your house. So you have to kind of get the police department number and the mobile crisis numbers in every area where the clients are. And it's broad because you can't just pick one in DC. It has to be like towards their neighborhood. And
Mm-hmm.
so having that and making sure emergency contacts are up to date. A lot of times couples will put each other as their emergency contact, and then you don't realize that until you need it. And you're like, uh-oh, who do
Yeah.
I call? They're both, yeah.
Yeah, yeah, and I think probably too. I know kind of one of the ethical standards around telehealth is not to see folks that are actively suicidal
Yeah.
via telehealth. It's just yeah, it's just too much of a liability and a risk for that.
Yeah.
So yeah.
Yeah, it's interesting though, because sometimes I've found that out later, and transitioning them to somebody in person after they've already built a relationship can sometimes be more
Mm-hmm.
detrimental.
Right, right. Yeah, and so maybe even using telehealth as a form of making the transition.
Mm-hmm.
Yeah, yeah.
Yeah. Yeah,
So
it's tricky.
yeah. So what are some other things that you've kind of figured out about having the type of practice that you have um, that maybe others aren't aware of?
Mm-hmm. I think like using the environment is really important, like being able to, like, whatever their goal is. So if their goal is organizing, if they have a hoarding pattern or they have an exercise like they're not exercising or they're not moving, or they're depressed and they're not getting out. So for people like that who are more isolating and staying inside, especially during this pandemic, having a session, sitting outside on their front porch, at least like seeing the sun, or people who need to move, having a session on an exercise bike, or people that have trouble organizing their stuff and they keep putting it off and putting it off, and they have piles of stuff everywhere. It's like, okay, let's go to that pile right now, and we're going to process through feelings before, during, and after. Just using whatever's around them. And then you also get to see, I always encourage people to look at what is around them, like their hygiene, their decor even can tell a lot about them. Any patterns of what they're eating, like you can tell, like sometimes you don't realize somebody is always eating McDonald's or whatever is going on, and they don't mention that in therapy until you see it.
Right.
Yeah.
Yeah.
Using the environment.
Yeah. And so with your consent forms and all of that sort of thing,
Mm-hmm.
how do you have that organized for your practice?
Yeah, I just build it into the informed consent because I feel like there's already a lot of forms, especially when you sign up with something like an electronic record system. They have to have, something learning how to access the client portal, learning how to access the messages and all of the billing and all of that. So I just put a section in there on technology and all the things for them to pay attention to, encouraging them to be sober during sessions. I've had a lot of people, using substances because you're at home and it's a little more comfortable. And we want their raw self to work with that. And just having troubleshooting things in there, having crisis numbers in there, just everything that, if I wasn't in the room with them, for them, it's important for them to know.
Right. Yeah. So is it, I'm taking it that this model that you're working on in terms of seeing folks maybe once a month is what I'm sure there are lots of advantages to that. And I love the idea about subleasing an office just specifically for that. Do you typically just block off 1 or 2 days to do that per month, or how does that work for you?
So I just block off a week, usually every couple months, and I will just rent by the hour. So whatever I use.
Right. Is it the same place every time, or do you move around?
Yeah, no, it's the same place. As long as they have the same, rent situation, and hopefully it lasts through this, this pandemic. But it's just the same place. And the clients like that. And it's more comfortable. They know where they're going each time.
Right. Yeah. Well, that's such a I had not thought of that idea about, making that balance between having an in-person practice and a telehealth. And you've really kind of created, I guess I would call it maybe a hybrid practice, which I love that. One of the blog posts that is probably one of the most downloaded that you've caused me to think about how I need to update that blog post now of really kind of thinking about unconventional ways of providing services. And of course, having a totally online, practice. I was going to say, sorry, I get off on these tangents, but it's one of the most read blog posts that I've got on the website. And it's just business models for private practice. And so I tried to outline just some different ways to provide services that are beyond just the traditional, face-to-face, butt and chair, in front of in-person kind of thing that requires, some higher overhead for doing it that way. And then with the, now with telehealth, we can do it. And like you said, work from home.
Yeah. And I've thought about that in hiring, because I'm at that point of I'm going to be hiring an employee. And I really want to keep that model of having somebody see people in person. It also really, I feel like it gets more clients too, because the fact that they know they can see you at least once and meet you. I mean, I feel like it's just more of a turn on than you're only going to see me online and I'm in another state. So knowing that the therapist is at least licensed in that state and able to see them in person at least every couple months. Right.
So that's exciting that you're going to be adding a clinician to your practice. Yeah. How did you come to that decision? And and you're going to be hiring them as an employee, which I know that's always a big question that people have, whether to just have a contractor versus an employee. So how did you make your decisions?
Oh, it has been a process. So the past, I would say 6 months, I've been really thinking about it, because I've had a waiting list of people that call and that I can't physically take anymore. Because I like to cap myself out at 25 at the most, but even that's a lot for me. And so I want to be, it's like, what can I do how can I help these people instead of just turning them away? So I originally thought I wanted to do a 1099, and then I'm very ethical and by the book. So I contacted lawyers in DC, which is where the LLC is. And they encouraged me that laws are changing now with 1099s, that there's this ABC law I don't know if you're familiar, but it's not necessarily valid in DC, but a lot of practices are getting in trouble because their clients are going after workman's comp or unemployment. And then when the IRS kind of reviews their practice, that they're kind of being treated as an employee because, and then the biggest thing is, because I was like, well, how is that? Because they're doing their own thing. I'm not controlling them. They're controlling their own hours, but they are and I talked to multiple lawyers and they say the same thing, that it's when you're doing the same thing that you're hiring someone to do. Like it's the mainstream of practice. Like I'm a therapist, I'm hiring a therapist. So because of just that it's seen as an employee. And then also, like I've listened to your people that you've had on talk about going from, 1099 to employee and you and all that people seem more invested in the company.
Right.
And I can have meetings and I can encourage them to, dress professionally during their telehealth visits. And I could, we could have case consultation. We could just, it could be a lot more personal, I think.
Right. Yeah. And I think it's, and that's kind of a trend that I'm seeing or hearing about, is that a lot of people are, just because of the various state laws. And I think, if you're in the kind of what I've noticed is that if you're in the Northeast, which you're kind of in that category, it's more difficult to have contractors because of the state laws and that sort of thing that are, whereas in the Southeast or in the southern states, they're a little more lax, I guess you could say that, just about how you do your hiring and that sort of thing. So it's a little easier to have contractors, but I think like you said, Danielle, you really have to weigh the benefits and the downside. And I think even though it's more paperwork and more money, more that you have to do with employees, in the long run, I think it just people are just much happier all the way around when you do it that way.
Yeah. They feel valued. Yeah.
Right. So, well, Danielle, I know I want to be respectful of your time and just your willingness to be on the podcast. Tell folks a little bit more about how they can get in touch with you. And I know that you're starting to do some consulting as well with other therapists. What's the best way for them to get in touch with you?
Yeah. Well, email. So dbtaylor@mymfts.com or my website, mymfts.com. And yeah, if anybody needs help learning about telehealth or how to open a practice or anything, I do, some consulting and helping them whatever path they're going down to help them with that. Awesome. And then also I'm hiring in DC. They're hopefully going to be licensed DC, Maryland, Virginia. So if people have clients that need therapy in those areas or Pennsylvania, just let me know. See what I can do.
Awesome. Yeah. That's a great URL, by the way. You were lucky to get that.
Yeah.
mymfts.com. Yeah. That's great. That's great.
Yeah. And that's my goal, is to have a marriage and family therapist.
Yeah. Awesome. Well, thanks again, Danielle, for joining me. And I'm looking forward to seeing how your journey goes and hearing more from you.
Yeah. Thanks so much.
Well, folks, I hope you enjoyed hearing from Danielle. And boy, I'm just was just really excited to hear about her model of doing telehealth and how she's doing her practice, particularly kind of what I consider kind of a hybrid way of doing it, of seeing folks once a month in the office, but the rest of the time doing telehealth, and then being able to sublease an office. That's such a smart idea, and is such a huge savings. I think, especially for people that might be living in areas where the cost of keeping an office and where leasing an office full time is just might be kind of cost prohibitive. And I would say too, if it were me and I was starting over today, I might even use a model like that. It just makes a lot of sense, just from a logistical standpoint, and just with all the opportunities that we have now with telehealth, and the fact that for those of us that are insurance based, is that insurance companies paying for those types of services. It's just huge. So anyway, again, I'm grateful to Danielle for joining me on the Practice of Therapy podcast, and I'm glad she reached out to me to be on this particular episode. Be sure to check out our sponsor, TherapyNotes, therapynotes.com, and now they also have a telehealth portal that's available through the patient portal on TherapyNotes, and it's a wonderful service, and I couldn't do without them. I use them in my practice for my electronic health record system, and particularly with filing claims, insurance claims, the patient portal. All of that is just second to none. And so be sure and check them out. And if you use the coupon code Gordon, just go to therapynotes.com. And if you use the coupon code Gordon, you can get 2 months of their services for free. And then also, as a reminder, be sure and check out Brighter Vision this month. They've got this huge sale going on, and now is the time to get your website in ship shape, and to make sure that your clients are finding you, and also that your website isn't driving potential clients away, which can sometimes happen just by having an old website that's not working well. So go to check them out. Go to practiceoftherapy.com/brightervision. And again, if you from now until July 7th, you can save $200 on their services. So be sure to check them out. practiceoftherapy.com/brightervision. And the G Suite course, I'll mention that here before we close. G Suite for Therapists course is on sale for the rest of June. If you use the coupon code just June 2020, and you can get to that at practiceoftherapy.com/G Suite course. And also go and check out the Facebook group. If you're using G Suite at all, that is a wonderful resource that we've got going in terms of being able to ask questions and get support from other therapists that are using G Suite. So again, I'm grateful to the people that are part of that group, and just really helping each other out. It's wonderful stuff. So take care, folks. Stay healthy. I hope that you're doing well and faring well during these times that we're in, and being able to stay healthy and do what we need to do to prevent the COVID-19 epidemic, but also just on another front, just with the whole Black Lives Matter movement, of just really making sure that you're speaking out and you're speaking up for those things that are so important for all of us as human beings, and how we treat each other. We've gone too long with racism being just in this underlying current, and I would encourage you to learn as much as you can about that, and do what you can to advocate for change. So take care, folks, and I hope you're staying, as I said before, staying healthy. And do take time to subscribe to the podcast, and wherever you might be listening to it, whether it be on Apple Podcasts, Stitcher, Spotify, Google Play, wherever. And be sure and leave us a review, and love getting that feedback. So do take time to subscribe as well. So take care, folks. Hope that you're have a good rest of your weekend, whenever you might be listening to this. You have been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free private practice startup guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.